Okay, fantastic. Folks are joining now. Okay, fantastic. Folks are joining now. Okay, great. We'll get started in a few moments. We'll let people join in the webinar. Thank you. All right, we'll give 2 more minutes for folks to join and then we'll get started.
People who are not speaking should mute themselves, but I think that's okay. We are muted, all of us.
Okay. Okay, great. So hello and welcome all to today's discussion on Pakistan's response to COVID-19. My name is Sarah Luttrell and I am the Communications and Events Manager here at the Center for International Development at Harvard University. Before we get started, just a few housekeeping items for today. During the question and answer session, you will be able to ask questions directly to the moderator via the Q&A function on Zoom. Due to the large number of attendees, we won't be able to address all of your questions, but we will do our best to get to as many as possible. We are also recording today's session and also streaming live on YouTube. So the video of this event will be available on the CID YouTube channel after the event. And without further ado, I would like to introduce the moderator of today's panel, Dr. Adnan Khan. Dr. Khan is professor in practice at the School of Public Policy at the London School of Economics and Political Science, a joint appointment with the Suntory Toyota International Center for Economics and Related Disciplines, and an affiliate of the Center of International Development. Dear Dr. Khan, thank you very much for being with us here today.
Thank you, Sarah. So let me start by mentioning that I'm stepping in place of Professor Asim Khwaja. Unfortunately, his father is not well. We all wish him and the family the best. So we are here to discuss Pakistan's COVID-19 policy challenge. It's an unprecedented policy challenge. There is radical uncertainty out there. However, this much is clear already from the experience so far. And this is not just true for Pakistan, but for other developing and even for developed countries. Copying solutions from outside doesn't work. It doesn't add to state capacity, in fact, undermines state capacity. We need to start from where we are, not where others are or where others think we are. And while there is a lot of uncertainty, flying blind is not a policy option. We need to do better than better in terms of utilizing, leveraging the information that we have, but also do a better job of actively gaining more information and refining our policy response as a result of that. It is also true that a uniform, unchanging response, policy response, may be very appealing, but that doesn't work because it violates one of the fundamental principles of this pandemic, that it affects different people and different places differently depending on the which phase of the pandemic we are facing. Finally, We need to move the policy discussion beyond the binary curse of having a lockdown or having no lockdown. A lot of developing countries, a lot of discussion, unfortunately, in Pakistan seems to be centered around the question of whether we should have a lockdown, whether we should open up or not. And that's a very artificial, very superficial discussion. We need to do better than that in terms of our policy discussion and our policy response. When we look at the Pakistan experience and having engaged with different governments, it is very clear that there are many positives to take from the policy response that each government and non-governmental actors in Pakistan are also doing. It's also clear that there are fundamental challenges still outstanding that each government and each actor still needs to address and resolve. And today we have an excellent panel to answer these questions. The structure of today's sessions is that I'll introduce the panel. Each of them will in turn speak for roughly 5 to 10 minutes each. I'll then pose a question to each of them, and then we'll open up to question and answers from the audience. So let me start with the round of introductions. Our first panelist is Maruf Syed, who is the president and CEO of Center for Economic Research in Pakistan, also has a close Kennedy School connection. He is a successful tech entrepreneur who chose to return to Pakistan. He'll be embarrassed by me mentioning, he chose to return to Pakistan after spending a quarter of a century outside and chose to contribute while being returning to Pakistan. Our next panelist is Najm Shah. He is Secretary, Government of Sindh Investment Department, has held many other portfolios, including Health Secretary in Punjab. He was the one who helped address the dengue challenge in Punjab. Has had many successful PPP, solar plant, also has a Kennedy School connection. So I'll describe him as a smart entrepreneurial bureaucrat. And this is not an oxymoron. There are people who fit this category, and he's one of them. So all power to these people. And last but not least is Tania Idrus. She is the Chief Digital Officer of Pakistan, appointed by the Prime Minister to help realize the vision of digital Pakistan. She was a senior executive at Google with many, many successful achievements. Again, in the same league of people, highly successful people who chose to return to Pakistan and contribute. So we have an excellent panel. Let me start off with Maruf, who can say something about COVID-19 response and the role of research and data and evidence. Over to you, Maruf.
Sure. Thank you, Adnan, and thank you, Kennedy School Center for International Development, for hosting us. Adnan's talked about a brutal, sort of binary world that a lot of countries and a lot of governments find themselves. And the way I think about it is, really we're facing a very dense fog in front of us. Even though we're 2 months or 3 months into this crisis, and time seems like a blur sometimes, the fact of the matter is there is still a lot of uncertainty, and the uncertainty is really coming from the fact that one size doesn't fit all. We really need to understand local context and local situations before we can even think of a response. So in Pakistan, SERP and many other organizations involved with us, we created a framework called Smart Containment with Active Learning, which is SCALE. And we took a big tent approach. The fact of the matter is this challenge really requires an interdisciplinary approach. So epidemiologists, infectious diseases specialists, economists, data scientists, tech folks, really coming together and looking at it from different lens. And the challenge, quite honestly, when you're facing a really dense fog is that you don't accelerate through the fog. You pause, you take stock of your senses and really imagine what data do you really have right now and what data can you acquire to make you be able to move forward. So in that spirit, we basically created this policy framework, and really has 3 essential elements. One is active learning. Adnan talked about the fact that context is really important. You can't really import things or solutions into this challenging environment. So active learning really requires you to act to learn faster, to really enable yourself to collect a lot of information and be able to inform your decision making. So really collecting representative outcome data every 2 to 3 weeks on 3 essential things: COVID related data. You're looking at testing and basically looking at where infection rates could be, to establish prevalence rates. Looking at non-COVID health outcomes or data, for example, maternal health and infant mortality, because when you're in a lockdown, a lot of mothers can't go to the hospital. Socioeconomic impact, we're looking at employing basically follow-up phone surveys to look at economic vulnerability or food insecurity in various areas. This data allows you to learn about the environment, about the context that you're in, and then approach it in a manner that allows you to address these issues. The second element of smart containment is really looking at grids or gridding, partitioning regions or cities into smallest feasible isolatable grids. So when you're talking about an urban environment, you're talking about neighborhoods. When you're talking about rural environments, you're talking about maybe a village or a collection of a village across a natural boundary. But the fact is that you're basically partitioning the region into grids so that you can understand what's happening in each of those grids. The third essential element of this framework is grading. So think of alert levels, much like what happened in the US, for example, around terrorism. You had Amber Alerts and so on and so forth. We've created sort of alert system that goes from green, yellow, orange to red, and really tailoring response to each grid. And grading these in the sense from both messaging point of view, community messaging, which is very, very critical, and looking at it from sort of compassionate enforcement as well as compliance. So at different levels, you collect different data, or you look at different ways of employing data to understand compliance. So for example, when you're looking at compliance, you could be looking at CDR data to say how social mobility is happening in a particular grid. When you're talking about messaging, really targeting those messages for a particular grid based on what kind of prevalence rates or transmission rates you have established in those grids. We talked about the fact that Pakistan is not alone in this, and we're really, a lot of times it's easy to fall prey to negativity, especially either then within Pakistan as well as outside Pakistan. And so I really wanted to highlight the fact that there are a lot of government officials, and we'll hear from Najm about Sindh implementation and from Tanya about federal interventions. The fact of the matter is that a lot of people are working tirelessly. I guess since Punjab government is not represented here, I can say that they really scaled up the smart containment and smart sampling techniques during Ramadan, and it's not an easy thing to do. And so really employing pool testing on one hand, which by the way lowered the cost by 1/3 in the cases that we saw, and really during Ramadan, really focusing on the fact that people are tested around these grids where infection rates are established, as well as trying to create early warning systems in areas where we're starting to see infection transpire. And what we saw, one quick anecdotal thing I'll share is that trust and messaging is really critically important in this. Messaging from the government, a very localized way in terms of targeting these grids, but really compassionate messaging and messaging that allows people to share the symptoms that they're experiencing, or not being in the fear that they will be ostracized or isolated based on whatever test result comes out to be. And we feel that this sort of compliance, any kind of policy requires public support. And so this messaging, and Matt Andrews has written a lot of excellent pieces on this, is very critical to drive this kind of framework forward. But ultimately, this is a data responsive policy framework. Thanks, Anand.
Thanks, Maruf. Let's now turn to Najam Shah. So he has the experience in Sindh. Maybe he can bring the Sindh perspective, but also his general insights from his policy experience. Over to you, Najam. You're on mute, by the way. So Najam, you're on mute.
Thank you, Dr. Adnan. Can I share some slides with the participants so to give them an understanding how do we cater for every day in this COVID response in the province of Sindh?
Yeah, please do so, but be mindful of the time as well. Thanks.
I'll be quick on that. So just to begin with, can you share the slide? I mean, are they visible now?
Click on full screen or slideshow.
I am on the slideshow.
Okay,
we can
we
see,
see.
but maybe there's a lag.
Is it available? Okay.
That's perfect.
About the, oh, fine, fair enough. So till I've already done 167,000 tests in Sindh. Yesterday we did 4,000. This is around 66% of the capacity of the testing capacity that we have created in Sindh, which was far less when we started in, say, March. The results that are coming up now are nearly 27% of the tests that have been conducted are coming positive. So cumulatively now it has become 15%, and there are many reasons why this is so high number, and we can debate on that and discuss on that, but this number has been increasing with all the other conditions as same as they were before: limited number of testing capacities and targeted testing or specific area testing or track and trace testing. Just another understanding is that almost patients which are under treatment are 14,000 patients, 11,000 are cured. Around deaths that have occurred in this province is 396. Yesterday was 16 deaths, and patients are mostly in their home isolation, which is 12,000, 88%. Few of them are 5% are in the isolation centers, and 7% are now in the hospitals. Out of these, 248 patients are critical in this province at the moment. If I look at a comparison with the other provinces, and this is a data sheet which I have taken from the federal government daily report from NCOC, 32% are during the last 24 hours have been confirmed positive in Sindh, as I told you, but the other provinces are also having 24, 25% positive in terms of the COVID positive tests. If you look at the number of critical went right now, 404, and out of these 193 in Sindh, and out of these 42 are on vent. People more are critical and which are not on vent. This is something which is coming up these days, and we'd like to look into it. If I look at the dip right now because of the suspected cases which have been reduced, is because of the Eid holidays. So the pattern will go up as the test being performed would be again coming back to 6,500 in this province and other provinces also. Just to look at the 3 days rolling averages, 20% are being tested positive now as compared to 10% which was on the 29th of April. So the numbers are increasing at the moment. If I look at the mortality trends in Pakistan, it's like average in, say, on the 18th of March, the lockdown in the province of Sindh and the other provinces happened in 22nd or 23rd of March. The average was 1.4, and right now it is 36 deaths per day. The critical patients number is 161 as compared to 404 are critical, but they are not on vents. 80% rise has been observed during the last almost a week in the critical patients which are not on vent. If I look at the situation, and these are the things that we take care of every day and discuss in every meeting. In Sindh, 388 doctors have been tested COVID positive, which is a big number as compared to any other province, which we have to really take care of and look into it. The lab capacities have been increased, but they are still limited and they are underutilized at the moment if you look at it. So around 43% on the total capacity is being utilized in the country, and yesterday's report says 32% of Sindh. Sindh was utilizing almost 100% capacity, but due to the supply chain problems in the kits, we have gone a little low during the last 4 or 5 days. If I look at the ventilators availability, and this was a very important point being considered earlier, that we would not be able to have that much number of ventilators available for COVID-19. The maximum utilization is in Peshawar and Faisalabad, in KP and Punjab, 48 and 41%. In Sindh, it is around 32% at the moment. In the last 24 hours, what we have seen is 2 deaths were at home, the rest were all hospitalized. The average stays that are coming up are 6.3 days, maximum 17 days in hospital. Most 27 patients, most of the patients died on ventilators. 75% deceased are having comorbidities, what we have observed. So if I look at the gender, 74% who died were males, and 72% were over and above 50 years of age. And as I told you, 73% had comorbidities. 93% of them stayed hospitalized. These are the some distribution of age and gender in the overall scenario. 75% confirmed that below 50, as I said. Mostly male. Again, in the deceased also, if you look at the numbers, the biggest number is from the year who is 61 to 70 years old, and then 71 to 80. The numbers who are getting infected are higher in the brackets of 21 to 30 and 30 to 40 and subsequent to 50. If you look at the provincial distribution, and again the most number of cases, Karachi, Lahore, Pindi, and Peshawar are coming up. Tanya would like to add more to it because she's looking at the overall situation in the country. If you go to this is I've already told you. If we go to the way forward on this, so this data I just wanted to share is that every day almost we have this briefing. Sometimes in a task force meeting, or otherwise separately in our small groups. And every day we try to manage how to move forward with this kind of availability of test kits, capacity of labs, the ventilators availability, the hospitals beds available. And it's a long presentation. I've tried to cut it short because of the paucity of time. And with this understanding, the capacity and situation, we would try to go for a smart lockdown. And that discussion was last month at the government of Sindh. The issues that were coming up were the pool testing and the capacity of testing kits for the pool testing, especially the swabs and the VTM. And we have been able to now produce them locally also and get them validated. That will really help in pool testing, and that would in turn help us in doing the smart lockdown. We have a good dashboard in which we look at the data and go for a specific area. So if you look at that, what we see is that if Karachi is catering for around 80 to 90% of the total load of this province. In Karachi, South was the hub of the activity, but now East has taken DC. Karachi is divided into 6 districts. So South district was going on number 1. Now it is the district East which is taking the lead, unfortunately, in the number of cases coming up. So area of focus is also right now available with the understanding of better data As we were discussing earlier also, the data was not that clean earlier, but now we are getting specific locations, cell phone numbers, addresses, and that is really helpful in doing a smart lockdown as we speak. So this is it about the data. What I want to tell you, the message that we are trying to give at the moment is to stay at home and just go outside when with a valid reason. If you can avoid it, please do avoid it. There are precautions and guidelines that we have given to the people. They're not being, and it is a repeated thing that has to be done again and again. Information dissemination is very important in this situation. These SOPs need to be time and again told and try to be implemented among the masses. Wear a mask. This is something that we are trying to inculcate among the people, and I do not see a large message penetration in the market at the moment, but I think that this has to be told time and again to the people. Extra care for elderly people with comorbidities or of elderly people who are with you, we have to be very careful about it. So this is something I just wanted to share. Thank you, Adnan. If there are some questions, I would like to answer them subsequently.
Thank you, Najam. We'll get back to you. We'll definitely want to ask you about what you see as policy challenges going forward, but we'll come to that in a minute. But let me now invite Tanya to share the federal government perspective in terms of data collection, data use, smart data use, and the challenges that you see in moving forward. Over to you, Tanya. And Najam, if you can unshare your screen. So.
Yes, I'm trying to, just give me a second.
Great, thank you so much. Thank you to the Kennedy School. Thank you, Sarah, for setting this up. Dr. Adnan for jumping in and helping, and also Dr. Asim for inviting me. Pleasure to be here. Very fond memories of Boston, which was home for about 15 years. So, while there's no connection to the Kennedy School, I used to live very close to where you guys are. So let me take a step back and just sort of, rather than, what Najam has just walked you through is actually very similar. So a large part of that is the data set that we review every day as part of a forum, which is actually quite unique. And I think it's worth talking about sort of how it was created and the function that it's serving. But what I'd like to spend a little bit of time on is taking a view back to about sort of 95, 100 days, sort of right when we got the first case of corona. And really the challenge in a country like Pakistan is, where health is a devolved topic, and really the management is largely done, systems are largely managed through provinces. At a federal level, it's actually incredibly difficult to get a view of what's happening in the entire country. So really when, I remember February 26th was the first case, and we were slightly late compared to a number of the other countries in Asia. And the fundamental first challenge was, how do we start to get a consolidated view of what's happening in the provinces? So we went through this process of sort of stitching together not only what was coming in through the various provinces, but actually realizing that we didn't really have time to go in and sort of build a new system. And one of the things that in hindsight ended up working was that we looked to see what type of national sort of data collection system in health was working. And the one that was very obvious that stood out was the polio system. And so what we did very, very quickly was we basically, jumped on the polio systems bandwagon and said, hey, this works. It's collecting data nationally. We just need to do some slight tweaks to understand what the important fields are that we need to be collecting. And then let's make sure that the provinces can keep using whatever they're using. They can use this national system, or we'll just integrate their systems into the back end. And again, for a country like Pakistan, to go through a process like that while you're in the middle of an emergency has been an incredible learning experience, because you realize that when you start to talk about data, it's just, we tend to, and this is something that Maruf often says, that we have a very unhealthy relationship with data in this country. But I will say that the importance of not only collecting, but collecting in a timely manner, making sure that and then getting deeper and deeper and collecting richer sets of data has improved dramatically over the past sort of, again, 90, 92 days where we've been in this setting. And just to start to give you some other small examples, we very quickly realized, as we got out of this whole monitoring cases business, that we needed to have a good system of monitoring deaths, and we really needed to understand the funnel. Rather than just figuring out where deaths were happening, we needed to understand how many people were coming to the hospital, getting hospitalized, getting onto oxygen, getting onto vents. We actually did have a national view of the total number of hospitals and the total number of ventilators about 90 days ago. And so a lot of this is, this is a classic example of sort of assembling a plane while it's in flight. But a lot of that was done sort of, again, over the last 2 or 3 months. And I think, as I come out of this, it's been an incredibly steep learning curve. But what that has done is that it started to give us a baseline. Are we anywhere close to where I think any of us would like us to be? Absolutely not. But have we made decent progress in the last 3 months? I think the answer from at least many of us who've been in it now for a couple of months is yes. So, again, understanding deaths was a whole other thing, because people were defining something as simple as on paper says critically ill. Different hospitals were defining what critically ill is differently. How do you get a standard definition and get people to actually report what that is? And so, those definitions evolved over time, and I think that's allowed us to get a far better sense of exactly what's happening, where hospitals are filling up, where do we actually need, when you're doing procurement for things like ventilators or personal protective equipment, where does it need to be sent? We had to do sort of quick tweaks to understand. So, just for example, logistics, getting personal protective equipment to the right hospitals at the right time, and actually in the hospital administrator's hands, again, was a fairly large challenge. And there's been, there've been a number of very interesting public-private partnerships that have come up, again, as a result of that. So TCS, which is a large logistics national carrier, now actually helps the National Disaster Management Authority in Pakistan distribute personal protective equipment down to the hospital administrators level. And we're doing that now based on sort of some sense of what the needs are coming in from provinces. As we got out of that stage of initial data collection, we then realized, well, there has to be a very, very detailed and, again, deep strategy that helps us do better contact tracing. The way contact tracing was initially happening was a patient would get tested positive, and literally they would have a verbal, somebody at the lab or the hospital would have a verbal conversation with them to try and get their contacts down and then go and trace them. But we needed to have some mechanism where we were really leveraging that sort of contact tracing mechanism and combining tech with it, just again to help us get to a more systematic manner. Because doing the sort of manual process works when you've got a few thousand cases. When you have a few 100,000 cases, it starts to get incredibly difficult. The stage that we're at now is we've built a number of these data flows. They're not, however, all talking to one another as effectively as they need to be. And so we're now in the middle of putting together sort of more of an integrated disease response and surveillance system, building on sort of what Maruf and Najam also talked about, which is actually a lockdown strategy that starts to get us down to the smallest possible geographical area, where we can start to understand, again, real time where outbreaks are happening, and then using some predictive analysis actually start to pass that information back down to the district level, to help district administrators understand that their particular districts may be, maybe in the next few days may get hit with an outbreak. So if that's happening, what are the measures that they should be taking right now? And I think as Maruf mentioned, and we've spent a lot of time trying to understand what is a sort of virus alert level, what defines moving from one level to another level, and how do your standard operating procedures change as you move from having no cases to 10 cases or 50 cases based on population density in an area. So that's now something that we're actively working on and looking to put together as a way, again, to try to add some value back to the provinces as well. The provinces, as Naja mentioned, are already doing an incredible job. But I think we all understand that this is something that's here to stay. And if it's here to stay, we have to build systems that scale incredibly well, that use technology, that again ultimately are allowing us to stay away from doing the sort of sharp, blunt lockdown that we did put in place. Actually, fairly early, I think as a nation, we were amongst, if you look at sort of time of first case to when the lockdown went into place, we were pretty quick in terms of putting a lockdown in place. But again, this is a country where when you say lockdown, it doesn't equate to the same type of lockdown as you would see in a place like Singapore, for example. So given those dynamics in the country, what are the types of things that we can do to help prevent the spread of disease to as much of an extent as possible? So that's really what the conversation is about right now. There are some very difficult policy decisions that have to be thought through, have to be made, again, based on data, based on empirical evidence, based on understanding of what other countries are doing. As an example, what do we do about schools? While there is a large relaxation in terms of lockdown in both industry as well as otherwise, and retail, schools are still shut down, and there's incredible pressure right now to make a decision on what should be done about schools. And that's an incredibly difficult policy decision. And you could argue that it's, when you're talking about lives and livelihoods for adults, it's a very difficult and different conversation. When you're talking about children, it's an entirely different conversation. And I think all the data in the world still doesn't help you get comfortable enough to make that call. So those are some of the questions we're grappling with right now. But I'll pause there and see if there are any questions at all.
Thanks so much, Tanya. Let me ask one set of questions from each of the panelists, and then we'll open up for question and answers. And this time I'll go in reverse order, starting from Tanya. So I had some experience with government, and one overriding theme coming from my experience was we were always in a firefighting mode. And while people stepped up fighting fires and helped put down many of those fires, we weren't necessarily better prepared to put down the next set of fires. And you're part of an initiative to help reform government, transform government. What is your experience in terms of building preparedness, resilience against shocks, and coordinating the actions of different players within and outside government, which is not something which is normally done in government? So this is for you. Let me start off with all questions to the three panelists so that they can prepare their responses. And so my question to Maruf is, you talked a lot about data and the importance of evidence. We typically don't have good data in Pakistan, and we don't have what many people say, a culture of using evidence in Pakistan. And how would you respond to the criticism that this data and evidence may be a luxury for other places? It doesn't necessarily respond to the needs of policymakers in addressing a pandemic like this, where they need evidence to inform decisions in real time and not on a typical researcher timescale. Okay. Najam, you mentioned quite a lot about Sindh government response, but I know you have experience in other countries, other places as well. We know there's limited capacity and limited resilience also. We had this lockdown, and it hopefully gave us some breathing space. But one question is, did we use it smartly to build capacity and resilience uh, to be able to better address future surges or future, like call it, waves of the disease? And are our health systems, our policy systems better prepared now? If not, where do you see the most important capacity deficits and how do we address those? So over to you, starting from Tanya. And let's be mindful of the time so that we devote a lot of time to question answers. Yeah, thanks.
You've just asked some pretty tough questions, Dr. Adnan. No, look, I think what you're saying is spot on. Actually, I will say that a large part of the time, the first sort of few weeks was, and I think this is the case. This has been the case everywhere. It was firefighting, just absolute unknown, unprecedented. Looking at not having enough data to react on, looking at other countries, and knowing that your healthcare capacity just is not going to be able to deal with anywhere close to what we were seeing in a number of other countries. All the models that we looked at that were predicting the Pakistan situation, whether you looked at the imperial model or you looked at the Singapore university model, everything, everyone predicted different scenarios. They all looked terrible. Actually, the Singapore one looked less terrible. That predicted that Corona would be over in the next few weeks, which it clearly isn't. But the imperial one, if applied to Pakistan, just looked like it would be a disaster. Look, I think in terms of building sort of resilience and thinking about sort of long-term transformation, I will say this is the single biggest thing that keeps me up at night. I think it would be a travesty that we go through this period, do a bunch of band-aids and try to make things work for COVID specifically, and we don't prepare ourselves for whatever the future pandemic is going to look like. And this is again in an environment where you have dengue, you have TB, you have HIV, you have polio. I mean, we're one of 2 countries in the world where polio still isn't eradicated. I think at the heart of a lot of this is fundamentally data reform. We have got to start to think about, we don't, so just, I mean, again, you probably know this far better than I do, but, as I've, since given that I'm still new in the system, our vital registry, isn't anywhere near where it needs to be. So we don't monitor births and deaths the way we need to. Just to give you an example, so during this period of lockdown, we've missed about 9,000 to 10,000 vaccinations a day, just in one province, in one of the large provinces in Pakistan. We don't even have the data on how many vaccinations we're missing daily in the other provinces. This particular province happens to have a vaccination digital registry, so we can see that. But, you can imagine what that's going to create, the disaster that's going to create 6 months from now. And again, as Maruf was talking, there's the whole other impact on non-COVID related health outcomes that, again, we're not having an active conversation about right now that we really need to. So I think, and again, I'm not going to give a perfect answer to your question, Dr. Adnan. I will say that there is a group of us that are thinking very heavily about how do we use this current scenario. The good thing is there's a lot of appetite to talk about data. There's a lot of funding on the table to build systems that last beyond COVID. And this is, in general, there is an approach of coming together and working together. And again, in an environment, for those of you that are familiar with Pakistan, an environment where provinces and federal on, again, topics like health don't often work together very well. this environment feels different. And again, maybe I'm being naive because I'm new, but from everything that I've seen and everyone that I've talked to, there is a forum called the National Command and Operating Center that meets every day. That is that has federal government, provincial government, and military that sits together. That has been meeting every day, 7 days a week. That looks at data, makes decisions, provisions new systems, looks at procurement, and not just for health, but otherwise as well. So, as I was mentioning earlier, as we think about things like an integrated disease surveillance and response system, anything we put in place is not going to be for COVID alone. Anything that we're starting to think about building has to be built with a sort of a scalable approach in mind, and it should be able to go and scale across really anything, and also actually go back and start to tackle some of these other pretty major health challenges that we face right now. So that is at the heart of what we're talking about. There's also a number of sort of policy and other reform measures that the health and the health ministry is looking at right now, which helps sort of start to take us towards more of a CDC-like organization in Pakistan. As we know, there isn't one that exists today. We've seen recently the Africa CDC do incredibly well in the past few years. There's very clearly a need for an organization like that in Pakistan. There's an active conversation happening right now. And again, I mean, I think there is the thing that gives me hope is that, however we come out of this, the reality is we are seeing what's happening to the economy and a number of other things. But however we come out of this, the things that will certainly come out of this are going to be mechanisms, systems, organizations that didn't exist before, that hopefully make us smarter, hopefully make us a little bit more prepared for what is to come in the future.
Thank you, Tanya. Over to you, Maruf.
Okay. Yeah, Nan, I think that's a very good question. And often the discussion in Pakistan centers around, we have bad data, or, this data exercise or data responsiveness is a luxury that only developed countries have. And I will, quite honestly say that it's even more critical for developing countries to look at data, and to build systems for the very reason Tanya also talked about, that this is a crisis. We have an immediate challenge, but we also have a sustained challenge, which is that this is going to have sort of impact in the long run as well. And these kind of pandemics and challenges may occur in the future as well. So really an opportunity to build systems. But I think the data aspect of it, quite honestly, data is the only commodity that increases in value with use. The more we use it, the more it will become more useful for decision making. One of the key exercises of data, which Tanya also alluded to, is that when you start getting into it, you realize actually what data gaps you have, which in itself is an excellent exercise, actually. And then really looking at the research timeline versus the policy timeline. And this was a challenge for us as an organization as well as a research and policy institution, that a lot of times we like to deeply understand problems and take, analyze them and offer our analysis. But in our approach to this was very policy responsive. We really engaged with the governments, and very fortunate that literally every single provincial government, federal government engaged with us. And so really engaging with them and forgetting about the research timeline, and really, this is kind of a war room that we're all part of, and we have to act immediately in that environment. So we had teams working very, very closely with, in Punjab's case, really, the health department, the commissioner's office in Lahore, urban unit, and very unfortunately lost Khalid Sherdil, who led urban unit in the recent crash in Karachi. But and then PITB, these people coming together, really saying, okay, what are the data gaps? I need the shape files or the maps from urban unit, and I need this from this particular department, and bringing it together and in real time, establishing those protocols, going in the field, actually collecting data, looking at what prevalence rates are happening in each grid, and informing that to the key decision makers so that they can figure out at a very granular level how should they respond to that data. So I will offer that it is actually the very reason that we have less systems. We need to actually look at data, collect data, and also leverage some of the data that we already have.
Thank you, Maru. Over to you, Najam.
Thank you. I don't know how to just make it in sentences. The experience in the health, both the provinces, the province of Sindh and Punjab, these are the largest provinces population-wise. Punjab is the largest. They have a different approach, and they have strong points and weak points. And if I look at the Punjab's public sector has a bigger capacity as compared to the Sindh. But Sindh has a very strong point in terms of the private sector. And they have really worked together with the private sector, especially during the last 2 months. I have seen that the public-private partnership, and Sindh is leading in PPP, public-private partnerships in this country for the last 10 years, is really good. So on the 22nd of March, I remember the capacity of testing was hardly less than 1,000. Right now, we have the largest testing capacity of 6,750. And this is not only because the public sector labs that were requiring some supply provided, but we private labs, and right now 19 labs are working in this province. If I look at the Punjab work on it, they have added 8 labs. They are adding 8 labs in the public sector to enhance their capacity further, which will take a month maybe, or almost they are already there. Looking at the capacity and the policy interventions that the province of Sindh did, because there was a specific requirement of isolation centers, we created, and Punjab also created, huge isolation centers and thousands of beds in number, especially in Karachi and Lahore. And quarantine centers were created initially earlier because the people who were coming from abroad needed to be quarantined. Thousands of beds and rooms were available for them in Sakhar, especially in Sindh. If I look at the capacity requirements of the hospitals and the ventilators, there are some questions, Q&A that have been asked is about the ventilators. Let me make you understand that 86% people who goes on the ventilator do not come back. So we have to be really understanding the situation that where we need to put our effort more. We need to not let them go to the ventilator in the first instance. This is the area of focus on which the clinicians are working. We are trying to figure out, Punjab is figuring out what kind of medicine should be given. We are also figuring out what kind of medicine should be given to them. The availability of oxygen supply prior to going on to the ventilator is very important. So ventilator capacity is not easy to enhance, not only in terms of the non-availability of the ventilators, but in terms of the non-availability of the trained staff 24/7 to operate those ventilators and their parameters. And again, if 86% people do not recover from the ventilators, it is a very daunting challenge that has to be addressed. But if you look at the tertiary care availability, the public-private partnerships came into action from the early days of the COVID-19 response. We partnered up with the Indus Network and the Afghan University Hospital Network. And both of them are sitting on this task force since day one, and also supporting the government not only in lab, but also in hospitalizations, and also at the task force on the policy interventions. Adnan, you must be aware of that the task force in this province has more private sector experts as compared to the public sector representatives and the secretaries or the government officers. If I see the future interventions, like we are working on the testing enhancement capacity is a daunting challenge, and it's a daily challenge. So we need to figure out how to flourish the supply chain, how to feed the supply chain, and there are shortages, of course, coming in the supply chain. The policy interventions that are coming every day, every country, every expert in every country come up with a different paper, different strategy, and everybody is learning as we go along in this pandemic. It is like I have never seen a pandemic in my life, but I have seen disasters. Disasters have three levels. First is the rescue, then relief, and then rehabilitation. But this pandemic has three at the same time, which is like a rescue, relief, and rehab all at the same time. So we have to look at the economy. We have to look at the impact that lockdown. We have to look at the medical support that we need to do. We have to take care of people going out, working, but not bringing in COVID at home, especially the elderly people. There are questions, and the question answer side is that why the schools are being shut. I mean, the schools are being shut in all over the world. The reason is that the prevalence is so fast. I mean, this spread is so fast. Children can bring that at home without having any symptoms, and that can really bring COVID-19 to your elderly at home. And that will be, as you see the numbers here, and I can share the numbers again if somebody wants to see them, that the mortality rate is higher in the elderly people. So these capacity enhancements were on the medical side. But if I look at the other requirements here is the way we need to live. I don't find the task force also doesn't see that the vaccination would not come in at least 18 months to 24 months from now. We need to find a way to coexist with this COVID-19 at the moment. So opening up the economy was inevitable, and that's why it's happening. But again, the way we work has to change. And we are working on those strategies, inshallah, from July onwards, and the financial year is coming in, ending 30th June. We will be bringing in more resources for work, improving, make the supply chains of delivery of services and delivery of goods for the people to work under the COVID-19 compliant mode. So this is on the economic side target that we would like to achieve, in addition to the capacity enhancements on the medical side. So I don't know, I can talk for hours on that, but I think I'm trying to cover the questions that have been given on the Q&A and what you have asked, Dr. Adnan. If something else, please let me know.
Thank you, Najam. Thank you, the panel. Let's bring in questions from the audience. There are a lot of questions on the chat room. Let me try to bring as many questions from there as possible. So one question is, what is the overall goal here? Is it some kind of herd immunity, or one can also ask the question differently, what should be the goal here? Another question is, how do you think of decentralization in the case of COVID-19 response? We have different governments here. And sometimes they seem to be experimenting or doing things differently. Is that a good thing? Does it add to the cost of coordination? Overall, how do you think of the experience of decentralization? There's a question about the expertise required to address this. So it's not just clinical, we maybe need policy-based experts, but do we also need people who can work on human behavior, psychologists, sociologists, and how do we bring them on board? There's a question for Tanya, which is in terms of lockdown. Can we use the lockdown to change the structure of the economy in terms of e-commerce, digital inclusion, what your normal portfolio was before COVID-19 shock hit? And how are you using this shock to basically to move to not just immediate response, but also to the long-term response? Question for Najam is, how is this information communicated to the public? You showed a lot of information. What is the government doing to increase awareness and change the behavior of citizens, the last mile problem, behavioral response? Question for Maruf is, how is scale updated and improved based on the lessons learned in the field? Does it also include lessons from other countries? A lot of questions. Whoever wants to go first, we'll have another round of questions also, but up to you. whoever wants to. You don't have to address all questions. Whoever wants to address whichever question should do that.
So if nobody's taking the lead, I may answer something. Regarding the information dissemination, this is a very valid and very important question. And to be honest, I think as much as one can do, it is still not enough to disseminate information to the masses. And there are many examples of it. It has to go from the top. So the national leader is taking the lead in Pakistan. The provincial leader is taking the lead in the province. And I mean, the leadership is not with the bureaucrats, it is with the politicians, because they lead the nations. And every day, the chief minister of this province all himself goes on TV and give a full briefing with this data at his hand in detail, and then the policy statement along with it. But that is the macro level. But if I look at the micro levels here, I mean, if you go for a zero prevalence testing, you need to go with the local politicians. And if you want to go in a religious area, you need to go with the local mosque Maulvi, and you have to do it. If I look at the digital side, Tanya would be able to give more information on it. But digital platforms, applications, national applications, provincial applications, Twitter accounts are sending information dissemination all across. But still the penetration is not good enough. Still the people are, it has to be hammered time and again. And we need to work as one nation together. And everybody, especially, I can see the maximum number of participants were 102 at this time. And they should be the ambassadors after this, that they should take this lead. Every one of us has to take this lead. This information has to be given to everybody and make everybody realize that we have to deal with it and be very careful about it. Regarding the issue of others, I mean, there are departments in the government sector, but we have had a panel of experts here, like clinicians and public health experts, and we are using them also to give this information. But people are very, I mean, everybody knows it's a pandemic, so everybody's playing their own part by themselves also. If you look at it, lately during the Ramadan, there was too much pressure about because it's the holy month of Ramadan, and everybody, alhamdulillah, fast and we pray, and everybody wanted to pray Taraweeh and be in the mosque. There was a lot of pressure on clerics also and Islamic leaders also. So there came in handy the clinicians and the doctors, and they make people realize that we have to be cautious, we have to be careful. So people are active. However, more effort needs to be done. Media is also working on it, but sometimes they swing somehow. I think it's an adaptive challenge. Adaptive challenges are the toughest challenges. You cannot resolve them through, and this I learned at a Kennedy school, so I have to mention. So you cannot resolve them administratively. A secretary can't resolve them. An IT expert can't resolve them. This has to be with the leadership. It has to be with a narrative. It has to be a very uniform, coherent narrative that has to be supported by media houses especially, and not only once but very regularly, with all its aspects, with all its I mean, pros and cons explained very clearly to the people, so the people will realize that only people can save themselves, only people can get this R0 below 1. Governments can't, administrative decisions, public-private partnerships, IT solutions, applications, they will not do it. So this is my take on it, and I believe that this could be the way forward. A lot has been done, but a lot has to be done.
I'm trying to figure out which question to answer first, Dr. Adnan, so you'll have to help me out here a little bit. Look, let me tell you just a couple of thoughts. I am schooled in the thought of sort of moving towards open data in general. Nothing that we are talking about here is data that impacts national security, right? So we should, everything that you're seeing and a lot of what you saw in Najam's deck, the data, the raw data should be made available, obviously anonymized. And that's the school of thought that I come from. I have not been able to win that argument up till now. However, I do very actively not only share data with the people I know who are modeling in various provinces. I also have a couple of private sector companies working with us on data projections and modeling. So we are trying to do what we can given the scenario. But again, this is an evolution, unfortunately. We're not just mindset-wise, we're not there yet. However, we do need to move towards that. It's just sort of how it is if we're going to move forward. There was a question around central versus provincial. Look, I think I will say that there are certain things where we absolutely cannot afford to have an uncoordinated response. So a perfect example of this is how we've been dealing with incoming passengers. Regardless of whether you land in Karachi, in Lahore, or Islamabad, there should be a single SOP around whether or not you're going to get tested, how long you will be kept in quarantine or held before you're allowed to go. We have gone through a series of those. We are now finally at a point where we are not going to be testing people and people will be sent home. But there's been mixed response, and that's created a fair amount of confusion in people's minds because they don't know what to expect. So there are in scenarios like this, it does not help when the response is absolutely different. And actually, to be fair, this has been a learning process for all of us. We've again, because many of us meet every day, there's a lot of information exchange and idea sharing. And for the most part, we've tried when there were things that were diverging that needed to converge, we've tried to pull them back together. Often it's been difficult and painful to do, but we've landed, people are trying to do the right thing, even if it doesn't appear so. On the communication bit, I completely agree with what Najam said. I think we need to do a far better job of consistent storytelling and building a narrative, not just actually for domestic consumption, but also, what has Pakistan's response been? Like, we should be talking about what our response has been to the world. There's actually been some incredible work, and this is something Maruf was saying earlier, there's been some incredible work that has happened, and, we haven't told that story. The fact that we've been using machine learning, AI, in terms of of predicting, the fact that we have in this environment of devolution, that we've had this sort of body coming together to coordinate response. We should be talking about these things far more cohesively. And again, I think there has been an increased understanding that the response needs to be coordinated. And I agreed with Najam that this is, in scenarios like this, if you can show unity and sort of get past the provincial political differences, these are the best situations a country will get and a leadership will get to actually bring people across political lines together. I think there's a lot more that we need to do there. I don't think we're doing nearly as much as we should be. But there is a very strong focus now, and I think particularly in the last sort of month or so, around communication and also around changing user behavior. Look, this is fundamentally, because this is going to be a long-term game. We are only able to tackle this if we are fundamentally able to help people understand that this is ultimately the response, and the way we control the spread of disease, or to sort of bring it down into manageable levels, is ultimately going to be a people-based response. We can do as many lockdowns and at whatever severity as we want, but that needs to really people need to start to understand that and really embrace it. So anyway, I'll stop here.
Thank you, Tanya. Maruf?
Sure. So I'll address the specific question first and just two quick comments after that. In terms of us updating our learning and updating our framework, there are two aspects to it. First of all, we have actually released all the information on our website, and we update it every 2 to 3 weeks based on learning that we are experiencing, engaging with local governments here in Pakistan, but also global knowledge. The Big Tent approach allowed us to bring 10 to 12 different institutions across the world. That really allowed us to really learn the local context, but also connect to the global knowledge. So this learning is really getting encapsulated, and every 2 weeks to 3 weeks, we're updating these documents that everybody can access and comment on. In terms of communication and trust, I think that's a really important thing to, as Najam and Tanya also mentioned, to me, they come in hand, right? We saw it in data where people started to either feel nervous about reporting their symptoms or comorbidities. For example, we know that in terms of incidence of smoking is higher in population, yet when we're looking at data people are self-reporting, then it's much less. That discrepancy is way too large and really points to communication background environment, but really about trust, right? As people have trust on the communication, on their governments, they really will be partner in this fight against this pandemic. Because without it, really a policy response, is good on paper, but we really need to ensure that compliance is also high. And what you'll see in Pakistan is not alone in this. Your compliance is inconsistent in various different contexts, in the US, in Pakistan, and other countries. So there is going to be some level of inconsistency, but it's really an opportunity for establishing that trust, that social contract between a citizen and its government, that the government is there to prevent this pandemic, but really focused on saving lives and focused on the betterment of the citizen. So I think in that environment, even communication or our look at compliance has to be at a much more granular level and capture the context that we're in. There's no single communication or single message that fits every single context. So our messaging and communication would also have to be very granular.
Thank you, Maruf. So we have almost come to the end of it, but there was a specific question for Tanya regarding the move to e-commerce and online learning and digital. Maybe you can quickly answer in a minute or so, and then we can wrap up.
Yeah, no, happy to do that. So on education, we've actually been engaged quite heavily with the Federal Ministry of Education. And when we started talking to them, they were thinking about and very close to launching a television channel, which I think we all agreed was fine, given that it was a broad base, but ultimately it's just one way, and it's impossible to really find a way to do any sort of two-way communication and understand outcomes. They are very close now. We've been working closely with them to bringing forward a digital portal as well, which helps sort of bring a lot of what they're showing on television on demand. Obviously, as we know, we are at a point where we're about 35% connectivity. So if we are going to expect the education problem to get solved, we have to solve the access and connectivity problem. One of the things that we've been pushing for very, very hard is to make access far more affordable. So we currently tax data at amongst the highest rates in the world. So my hope is in the next few days, I've been promised days, not weeks, that we will see a reduction in the tax actually that ultimately the consumer has to bear on data. The reality is if you don't improve affordability and access, really anything that you're talking about in terms of whether it's education or e-commerce or digital payments really comes down to a halt. So that's sort of basic premise. The other thing I will say is on e-commerce, actually having been in touch with a number of the e-commerce companies, actively engaged in terms of trying to figure out what we can do at a policy level to try to help during a time like this. It's a tall order because these decisions and sort of policy ownership sit in various ministries and all over the place. But this is about as good a time as any to start to push towards sort of the right types of changes so that we can see a massive growth in these industries. But
Thank you,
I'm
Tani.
happy to take ideas.
Thank you. I hope the audience will take up you up on your offer and share ideas. So there are a lot many questions, but unfortunately we have come to the end of it. Thank you very much, the panel. I think we'll all agree that it was an excellent panel and a very decent, very nice debate. So, and thank you very much to the organizers, Sarah, Rosemary, Rosemary, and others. And thank you very much to the audience for participating. Thank you.
Thank you, Don. Thanks for having us.